Self-care, mental health. The second aspect of self-care is taking care of our mental health. I have already said that life is stressful, and now we live in some of the most stressful, and as I keep hearing, unprecedented times. The government is shut down, employment is uncertain, the bills are long and the money short for most people, while a few people have enormous wealth. We live in the era of modern technology, where people you do not know can spew hatred online over something that you post, where it is now okay to belittle, dismiss, and say vile things about anyone that is different from self. Our children are facing unprecedented times. There is that word again. Pressure from their peers in person and online, creating an attack on the psyche that we have never seen before. When I worked in the ER as an RN, I saw children as young as 6 years old being brought in for evaluation and treatment of mental health issues. And I will tell you that there are few mental health hospitals that are equipped to treat children who are that young. But this is where we are. I have heard it reported on the news that one of the things that happened during the pandemic, when everything was shut down to prevent spread of the disease and everyone was told to isolate, was that mental health illnesses increased due to loneliness in a lot of instances, and domestic violence increased in a lot of the families isolated together. We also had untold grief from the frequent and high volumes of death, where people were unable to properly mourn or say goodbye to their loved ones in person. I believe that has also had a lasting effect on our collective mental health. So here we are, and how do we move forward? I would say to my patients, please guard your mental health. Pay attention to the signs that you are struggling. Do something. Seek help. Meditate. Take some time off from work. Practice mindfulness. All methods that I will talk about later. If you feel like you want to scream but cannot, because you might not be able to stop, that is a sign that you are struggling, and you are not alone. The fact of the matter is that mental illness will affect 1 out of 5 persons, and 100% of us at some time or another have experienced anxiety or depression, although most of us can overcome it. Some mental health illnesses have a genetic origin to them that can be triggered by stress or caused by environmental factors such as domestic violence, physical and verbal abuse. Most times, people do not seek help until they are in crisis mode due to the stigma that still surrounds mental health. I want us to recognize the symptoms to get the help we need before we get to a crisis stage. I want us to move past the sentiments that men or boys don't cry, or to man up. When I was growing up, every Sunday when I went to Sunday school, when the roll was taken and our names were called, we were required to respond with a Bible verse. It was a way to help us learn and memorize the Bible. You know the, "Thy word have I hidden in my heart," memorize. One of my classmates every single Sunday would recite the shortest verse in the Bible. Jesus wept. He was being lazy, and we thought it was funny. But years later, as I have gotten older, I now understand how truly profound that 2-word sentence is. That even Jesus felt grief that caused him to weep, to cry, to express deep emotions by shedding tears. We can learn from it that tears can help us heal, and crying is part of the grieving process. It is okay to cry. Before the sentence stating that Jesus wept, the Bible tells us that Jesus was told that his friend Lazarus was sick, but he did not leave where he was immediately to go to him, and then he died. He tarried, waiting 4 days before he went. By that time, Lazarus was buried and stinking. Jesus knew that he could bring him back from the dead. I also think he wanted us to know that when you are hurt and angry and tired of being tired, it is okay to cry. Because if Jesus wept, so can we. We also need to remember that not taking care of our physical selves, as the first episode described, can also trigger mental health issues. I know that I am repeating myself, but not getting enough sleep can lead to anxiety and decrease mental capacity. On the other hand, sleeping too much can be a sign of depression, especially if it is associated with loneliness and feelings of helplessness and hopelessness. If you are having such feelings, it is time to get help. Make an appointment with a healthcare professional. There are outpatient mental health clinics in most communities where they welcome walk-in clients. Go. Exercising, even when one does not feel like it, is helpful in releasing endorphins, as mentioned before, to help relieve depression in mild cases. Again, getting enough sleep helps the body to repair itself. Being stressed is part of the body's fight or flight response to help us evade or get away from danger. However, feeling stressed constantly, which occurs in PTSD, can cause the body to produce inflammation, which in turn creates physical problems like cardiovascular disease. Some of the other mental health issues that can occur include eating disorders, anxiety, schizophrenia, and can progress to self-harming activities or even suicide. The problem with mental health illnesses is that people can look fine on the outside initially, so that there is no clue to the mental anguish that is taking place inside. The outward signs appear when there is a change in speech, or people start talking about themselves in terms of not being around, or start giving away their possessions, start looking unkempt, not caring about their appearance or hygiene, no appetite, has a plan to harm or kill themselves. This is crisis time. Time to get to the ER. Seeking help is not a sign of weakness, but of strength. Seeking help. Embracing the strength to heal. Philly EMDR. That you have overcome fear to get what you need. It may be time for medication and/or hospitalization at this point, which is okay to get back to being healthy. Some people self-medicate by drinking alcohol excessively or taking drugs legally or illegally. That just makes the problem worse. First, it does not help. It may feel temporarily like an escape, but can lead to physical problems like liver failure, pancreatic cancer, and drug overdose, among other poor outcomes. We need to work on ourselves to prevent getting to the crisis point. I already discussed making sure we get enough sleep, exercise, hydration, and eating nutritious foods. But there are some other things that we can do. Mediation is one of those things. It helps to calm the mind and emotions, which helps to decrease and relieve stress. It helps to increase focus, which may lead to solutions for some of the problems causing stress. It can relax the body, which will allow us to be able to sleep better. There is a 2-minute mindfulness meditation that is recommended for use just before entering stressful situations. It entails closing your eyes, taking in and letting out deep breaths slowly. It helps to calm the mind and decrease the heart rate, which in turn can help lower blood pressure and stress levels. Take a vacation. It can be a staycation, so long as it is time off from work to allow decompression and relaxation. Do fun things with family and friends, like going on a hike or see a movie. Have a game night. Talk to a close friend or family member who you know will keep confident anything you tell them. Sometimes we just need to ventilate. I cannot tell you how many times I have said to people in casual situations, "How are you doing?" And I get an outpouring of what is going on in their lives. Sometimes people just need someone to listen to them. Not give advice or instructions on what they should do. Just listen. If you know anyone who is struggling with their mental health, please encourage and/or help them get the help that they need through their provider or by calling 911 or 988. As always, I look forward to your feedback while wishing you all good health. Be blessed. References: Holy Bible, St. John chapter 11, verses 1 to 44, www.psychiatry.org. Myths and Facts About Mental Health, March 5th, 2025, www.psychologytoday.com/mindfulness, www.mindful.org. How to meditate.